Behind the Mask with Dr. Brian Ciccarelli, sponsored by...
Did you know that every 65 seconds, a patient develops Alzheimer's disease in the United States? And that's why we're here today. We're here at the Dayton Center for Neurological Disorders, and we're going to talk to Dr. Ken Pugar, a recognized neurologist here in the Dayton area. He has spoken nationally on the topic of Alzheimer's disease, and I feel that he's a tremendous asset to our community. My name is Dr. Brian Ciccarelli, and welcome to today's segment of Behind the Mask. Now let's go on in and meet Dr. Pugar. So here we are today, walking into the office of Dr. Ken Pugar. He's a board-certified neurologist in Dayton, Ohio, and a regional expert in the area of Alzheimer's disease, which is going to be our topic of discussion today. Hey, Ken.
Hey, Brian. Thanks for coming by.
Thanks for having us today. So, Ken, I know we're going to talk about Alzheimer's today, and if I were a patient, I would be kind of nervous about seeing my neurologist about that. Can you put my mind at ease on how you'd go about an examination today?
That's understandable. We'd come right back here.
Exactly where we would go and what kind of room you would examine me in, and do I need to bring somebody with me?
Sure. Good questions, Brian. This is a typical exam room, and that when someone from my team brings a patient back, I prefer a family member accompany them just for that reason, so I can have verification of the history that's so important to me.
Gotcha. Thanks for being here today on our first episode of Behind the Mask. And as you know, we're here today to talk about Alzheimer's disease. And being that you're one of the local experts and one of the leading authorities on Alzheimer's disease, I would like you to just start by explaining, what is Alzheimer's disease?
Alzheimer's disease is one of the dementias. It's the most common of all the dementias, representing somewhere between 60 and 70% of all dementias. Now, dementia are conditions that affect how someone's brain works. So we define it as a decline in multiple realms of brain function, of just how the brain works. One of those has to be memory, but it can't just be memory. It has to be something else too, either language or visual spatial analysis or reasoning or judgment. So it has to be memory and something else. So again, all Alzheimer's is dementia, but not all dementia is Alzheimer's disease.
So when we see people as they get older and they become more forgetful, is that dementia?
No, not necessarily. As a matter of fact, as we get older, it's not unnatural for our memories not to be as good as they used to be. The key factor, Brian, is whether or not that memory loss interferes with the quality of your life and your ability to function on a day-to-day basis. So if you went into a room to get something and forgot what you were going in for, but then later remembered, or maybe you forgot somebody's name and then an hour later, oh yeah, that was Bill. That's nothing to worry about. But if that memory loss is such that it interferes with how you function day to day, that you're not able to perform tasks or duties that you normally do, yeah, then that's something you need to worry about.
So what age group is most commonly affected then by Alzheimer's?
It's a great question, because age is the #1 risk factor for Alzheimer's disease. Far exceeds every other risk factor combined, to a point that if you make it to 80 years of age, that you have about a 40% chance of having some sort of dementia. And even just at the age of 65, probably somewhere between 11 and 14% of everybody may have a form of Alzheimer's dementia.
So as we get older and we become a little more confused, what should drive a person to go see a physician or a neurologist like yourself? What would be the #1 reason if I noticed a change in somebody in my family? Why should I go see a neurologist and bring
Well, first and foremost, if you think memory is beyond that of others their age group. So, you might know lots of people who are 65 or 70 years old, but if your loved one has more memory loss than what you think is normal, That's by far and away the biggest red flag that you should at least get it checked. But there are other things too. Are they making poor financial judgments, for instance? Is there been a behavior change? Are they more withdrawn socially, not hanging out with the people they used to? Do they have trouble driving, where their visual spatial abilities aren't as good anymore? Or they're just not able to do certain things they used to do, like maybe sew or use tools or a remote control or a microwave. Day-to-day things like that should definitely be a red flag to have it be checked. Now there's a condition though that's sort of in the middle between dementia or Alzheimer's disease and just age-related memory loss, and we call that mild cognitive impairment. And you might say, well, why is that important to recognize when memory loss is more than it should be but not yet meeting criteria for dementia? And we think that is important because that allows us to perhaps intervene at a much earlier stage with certain strategies and maybe treatments down the road that could have an impact on that.
So you use the term cognitive disorder. Can we tell the viewers what that means?
Cognitive disorder just means a change in the way you think. So your brain is by far and away our most complex organ in our body. So it's responsible for everything. So cognition can be your language, your ability to do math, other problem solving, memory, all those things, reading and understanding what you read, following a movie or a script. So all that has to do with cognition.
I see. So you brought up a statistic earlier when you talked about age being related to Alzheimer's, and you and I had talked previously about the volume of Alzheimer's being diagnosed or people developing Alzheimer's daily. Can you share with the audience that stat again that you gave me?
Yes, I mean, what we have to realize, and I don't think even today the public doesn't understand, is the magnitude of this problem. I mean, Alzheimer's is an incredible problem, and then since age is the #1 risk factor, as we have many, many millions of baby boomers getting older, we're going to see this problem just explode. In fact, we already are in numbers. We believe that someone develops Alzheimer's disease in the United States every 65 seconds.
Wow.
And the numbers now exceed, right now there's over 5.4 million Americans living with Alzheimer's disease.
So Ken, is Alzheimer's progressive?
Brian, that's a great question. And in fact, it has to be progressive in order to be Alzheimer's. So one of the criteria we have, the disease has to get worse over time. And another criteria that must be there is it can't be explained better by something else. So we ought to make sure that's actually what it is. So before we talk about the progression, why you need to see a neurologist early on, or at least someone else with expertise in this area, is to make sure that the explanation for you or your loved one's decline isn't due to something that we potentially could treat. You know, we should make sure that their thyroid's not out of whack, or we should make sure they don't have a brain tumor or some other condition in their brain that we potentially could reverse. So that's very important. But as far as the progression, unfortunately, its progression is inevitable. And as it progresses, it creates a greater and greater caregiver burden. And I can't emphasize enough the magnitude this disease has on the caregiver. It is absolutely devastating. Virtually billions of hours a year in the United States caregivers spend taking care of their families afflicted with Alzheimer's disease. And the devastation this takes on families, incredible. Caregivers, just caregivers of someone with Alzheimer's compared to someone off the street, have significantly higher levels of hospitalization, of heart disease, and of other serious medical illnesses, depression, anxiety. It's truly an unbelievable burden that we must address.
So Ken, if you can explain in layman's terms just exactly what happens to the brain in somebody with Alzheimer's.
Well, it's very complex, and I'll try to keep it in as simple terms as possible. But what we think happens, again, the brain is the most complex organ in our body, so there's likely many things happening at the same time. But clearly, abnormal proteins accumulate in the brain. And we've identified several of these proteins. One's called amyloid, one's called tau. But when they deposit in the brain, they set up inflammation around that, which ultimately results in destruction of brain cells or neurons. And as the brain continues to lose neurons, even though we have trillions of them, eventually though the patients will begin to show symptoms of that.
So is there anything that the average person can do to prevent Alzheimer's?
So the answer to that is we don't know. Okay, we have come up, however, with some strategies that we think may delay. I don't want to say we can prevent, because we still don't even know the true cause of this condition. But certain things that we've come up with that seem to delay is taking good care of yourself. So there seems to be what we call a heart-brain connection. So all the things that everybody knows for years have been good for your heart: keeping your cholesterol under control, watching your blood sugar, not smoking, keeping your blood pressure, and sugars under control, as I said. All those things are also good for your brain. In addition, we've learned that staying active is good for your brain, both physically, socially, and cognitively. For instance, a recent study showed that older women who continue to work outside the home, that provides protection against Alzheimer's disease. We've learned even that being married opposed to being single provides protection. So that seems to indicate there's some social stimulation that seems to be protective for the brain.
Sure. So Ken, now comes a segment of the show where I get to take off my mask as a physician and look at this from the patient side. So I'm going to ask you questions that I think patients should ask, or maybe they forget to ask or are afraid to ask. And I'd like you to kind of keep your answers very short, to the point, answering my question that I could understand as a patient. So the first question I have is Alzheimer's genetically passed on? If you make a diagnosis of Alzheimer's in my mother or father, do I have to be worried about getting Alzheimer's?
Well, Brian, that's a very appropriate question, and one that I see many times. I see the fear in the eyes of the children who bring their parents in to see me after I make that diagnosis. So, for the most part, the answer is no. There are some types of Alzheimer's disease that we refer to as YOAD. That just means young onset Alzheimer's disease, where there's a pretty powerful genetic predisposition, but they're fairly rare. By far and away, the most common Alzheimer's patients who are elderly, when we make the diagnosis, the chances of them passing that down to their children is actually quite low. So, in summary, if your mother or father had Alzheimer's disease, you have a higher chance than someone else off the street. But the chances are still overwhelming that you will not get the disease.
Okay, that's good to know. So Ken, you just diagnosed me with Alzheimer's. I'm a 70-year-old patient. How long am I going to be able to drive?
Well, that's an individual case, Brian, and I wish I could give you an answer. I have hundreds of patients with Alzheimer's disease, and there's not two of them alike. And they can be affected in different ways. Some people's language might be affected for years while they still have pretty good motor functions. So I always tell my families that's something you have to monitor very closely. And driving is an enormous issue with patients. You can understand how reluctant they are to have that independence being taken away from them.
Sure.
They very much resist that. So fortunately, just about every driving school and most occupational therapy institutions around this city, they offer what we call independent driver evaluations. Well, they'll do that and let us know, is it still safe? Not only from a cognitive standpoint, but is their judgment, their vision, reflexes, depth perception, still allow them to safely operate a motor vehicle?
So again, getting back to, you made the diagnosis of Alzheimer's, and I have a job as an accountant. Can I continue my job? Is there some obligation you have to talk to my workforce about my diagnosis, or is that something that's protected by law that you can't give that information away?
Well, HIPAA, of course, prevents us from sharing information to people you don't want us to share it with. But what I tend to do is talk to the patient and the family and to say, hey, I have no problem with you continuing to do these things. I think it's good for you, as long as you're still able to function. You have to still demonstrate you're able to do the job. Now, there's some professions, of course, if there's an accounting error, That's more easily correctable. I have some patients who are physicians, and no, I have to have a talk with them and say, you know what, the time has come where you shouldn't be doing this anymore, because the consequences are so great.
Sure. Now, is there any medicine you can give me to treat my condition?
The short answer is to treat the disease, no. And this has been extremely frustrating for us. We don't have anything right now that actually treats Alzheimer's disease. That said, though, in addition to some strategies that we talked about staying active and having a heart-healthy lifestyle, there are medications that we've discovered that can slow down the speed of the decline. So I tell my patients all the time, I want you to think of your dementia or your Alzheimer's as a truck. And for 70 years, your truck's going along nice and smooth on the road. Then it starts to go down the hill. And after a couple years, people start to notice it. Well, the medicines that we have can't make that truck go in reverse, but we're able to put a brake on it, slow it down so it doesn't get as bad as fast. And I think that's worthwhile.
Okay. And if I take that medicine, does it have any potential side effects or things where I will really feel terrible taking it?
For the most part, no. Now, granted, like any medicine, you look it up in the PDR, there'll be 1,000 side effects, but by far and away, compared to other medicines, these are very well tolerated. The most common side effects my patients complain of are GI. It might affect their appetite, cause some nausea, maybe a little diarrhea.
Gotcha.
But for the most part, they're well tolerated.
Okay. Is there any blood test I can get to see if I have Alzheimer's?
That's another fabulous question, because this is where so much of our research is going. We call this biomarkers. So what we're trying to come up with is an inexpensive, non-invasive test to see if someone is likely to get Alzheimer's disease, or not. We think that can have huge implications, and we're not there yet, but we're getting pretty darn close to it. So stay tuned.
Okay. Is there anything over the counter you hear all the time that there's supplements out there that improve your memory, that I should be doing crossword puzzles, that I should be staying active with things that educate my brain? Does that slow down the progression of Alzheimer's?
Well, I've seen dozens of supplements being promoted for this throughout the years. And as far as science goes, I'm talking about a study that conclusively shows that it works, none of them do. Right now, one that seems reasonable is turmeric. But I know a lot of the other ones that they're advertising all over the news and TV, including ginkgo, have never once been shown in a clinical trial to be of benefit. Now then, for a while, all the things like luminosities were out there on the market, and there's no secret about that. But they also have had to change what they claim. That said, we talked about activities that keep the brain stimulated, certainly aren't harmful, and I generally recommend it.
Okay. So Ken, it sounds like, though, to get a diagnosis of Alzheimer's is really a bad diagnosis to get. And is there anything being done research-wise to give patients with this diagnosis of Alzheimer's hope?
Yes, and it's growing. And I'm so grateful. For so many years, I was frustrated as a neurologist that this horrible disease wasn't given near the attention as other diseases have been given. And that is finally starting to change. Now there are billions of dollars every year that go into research. And while I'm very frustrated to say we haven't had a new FDA-approved medication for 15 years, there's a lot in the pipeline. So I'm optimistic that we're going to come up with strategies in the foreseeable future that are going to be beneficial. It's not going to be just one thing, Brian, in my opinion. It's not going to be, oh, we're going to give you this medicine that's going to cure it, because the brain is such a complex organ. We're going to have to hit it in many different ways, sort of like we do cancer. Inflammation and amyloid and tau and supportive cells. We're going to have to hit it from all those different angles, but I think we will begin to see a difference.
Well, that's good to know. So Ken, in concluding our presentation today, is there a support group out there that you would recommend for people or caregivers that have this diagnosis of Alzheimer's?
Without question, and not only that, I encourage it strongly. unless you have gone through caregiving someone with dementia, you don't understand the magnitude and the burden that this is. And it just keeps getting worse and worse year after year. So I strongly encourage all my caregivers to utilize the Alzheimer's Association. We have an outstanding one right here in Dayton. We have the Area Agency on Aging, which is another outstanding organization. Use your church groups and other social services. Just basically, get all the help that you can. Many of our caregivers are of the so-called sandwich generation, which means not only are they caring for a parent, let's say, but they're also still of the age where they might be caring for teenagers at home. And these women, and they're mostly women, are just stressed to the limit and really should seek all the help they can get.
Okay. Well, thanks, Ken. I think this answers a lot of questions that people have. Appreciate your expertise and sharing it in a way that everybody can understand it. And again, thanks for your time.
You're very welcome. Thank you, Brian.
You found the first episode of Behind the Mask informative. I know I learned a lot about Alzheimer's disease, and the number one thing I learned is all Alzheimer's is dementia, but not all dementia is Alzheimer's disease. I think it's important you also understand that as soon as you recognize that you or a loved one is starting to experience some of that memory loss that Dr. Pugar referred to, it's probably best to seek medical treatment sooner than later. So if you're interested in seeing a neurologist, Dr. Pugar's information is listed on the side. I would highly suggest reaching out to the Dayton Center for Neurological Disorders if you or a loved one are concerned about having Alzheimer's or want to be evaluated for the condition. For additional information, don't hesitate to look at the American Alzheimer's Association website. So thank you for joining us for this episode of Behind the Mask. I would like to thank you for tuning in, and I look forward to hearing from you for suggestions regarding future topics on this show. So until then, I'd like to say thank you for joining us from Behind the Mask.
Behind the Mask with Dr. Brian Ciccarelli, sponsored by